Losing a tooth carries a heavy weight. It alters how you carry yourself, and it often leads to that quiet hesitation where you hide your mouth the second a camera comes out. It also disrupts the most basic parts of your day. Suddenly, chewing your favorite foods becomes a chore, and articulating certain words feels unnecessarily difficult. The anxiety usually grows when you think about the solution. Many people put off treatment because they picture the clunky, obviously artificial teeth from decades past and the social embarrassment that comes with them. But dental technology has completely moved on from those outdated models. Today's restorative options are engineered to be highly aesthetic and custom fit specifically to your facial structure. Modern restorative dentistry focuses on returning your appearance and daily function to their natural state, allowing you to move through life with total confidence. When you start looking into these modern solutions to replace missing teeth, you'll quickly run into the two main removable options: partial dentures and complete dentures. It is easy to look at this as a menu where you simply pick the one you prefer, or perhaps decide you want a fresh start by pulling everything. This diagram shows the clinical reality. Your path is a diagnosis dictated by your mouth's physical state. On the first branch, strong, healthy remaining teeth dictate a partial denture. On the second branch, teeth compromised by decay or completely missing demand a complete denture. Because of this, a clinical expert will actively advise against your wishes if you walk in asking for a treatment your anatomy simply doesn't support. Understanding your specific clinical baseline is the only way to know exactly which appliance you actually need before you sit in the chair. Let's break down the partial denture. You qualify for this if you are missing one or several teeth, but still have a solid foundation of strong, healthy natural teeth left in your jaw. The appliance itself is built from high-quality replacement teeth set into a pink, gum-colored plastic base. To keep that base secure, it usually features a metal or acrylic framework with small, discrete clasps. These clasps physically grip onto your existing healthy teeth to anchor the structure in place. When a tooth is removed, surrounding teeth don't stay put, they naturally drift into the void. Dropping a partial denture into that gap acts as a rigid physical placeholder, creating a solid boundary that stops adjacent teeth from moving. Preventing this jaw drift keeps your bite aligned, which protects your remaining natural teeth from taking on uneven, destructive wear and tear when you chew. So the strategy behind a partial denture is preservation. You are protecting the healthy teeth you have while seamlessly filling in what you've lost. Complete dentures are required when your baseline is different. You are either missing all the teeth in an arch, or the teeth you do have left are compromised beyond repair by decay or gum disease. This means making the difficult but necessary decision to safely extract those failing teeth so your gums can properly support a full arch option. Because you don't have natural teeth to act as anchors, a complete upper denture is designed to cover the roof of your mouth, relying entirely on natural suction to stay secure. The lower complete denture requires a different shape. Built like a horseshoe, it leaves functional room for your tongue to move and articulate naturally. Total tooth loss causes a hidden structural problem. Without teeth to prop up your lips and cheeks, facial muscles cave inward, visibly aging your appearance. Inserting a complete denture physically pushes those sagging muscles back out to their natural resting position. By providing this internal support, the denture restores the vertical dimension of your face. It acts as an instant, mechanical anti-aging solution. Complete dentures serve as a total structural and facial restoration tool, providing the necessary foundation to support your natural profile while allowing you to eat and speak normally again. Even understanding these mechanics, the biggest hesitation patients have is the fear that their denture will slip out or shift during a conversation. Modern dentistry solves this using precise impression techniques. Clinics now map the exact micro-contours of your gums to guarantee a secure, custom fit that stays locked in place. Then there's the aesthetic concern, the worry that the appliance will look obviously artificial to anyone standing nearby. This side-by-side comparison shows how far materials have come. We've abandoned the flat, monochromatic plastics of the past, replacing them with modern, subtly translucent materials that look and reflect light exactly like natural enamel. These appliances are custom crafted in a dental lab to match the exact natural shape, size, and shape of your previous natural teeth. This level of custom manufacturing means the old compromise is gone. You no longer have to choose between functional chewing and natural aesthetics. So, how do you evaluate which restorative path you are actually facing based on your own dental reality? This scorecard maps clinical inputs to two profiles. You fit the preserver if you have healthy teeth remaining, require discrete clasp anchoring, and must stop natural teeth from drifting. You fit the total restorer with a compromised arch, needing suction-based anchoring and total facial support. Identifying your specific profile removes the stress of choice, empowering you to walk into a clinic understanding exactly why a dentist will recommend a specific appliance for you. You don't have to navigate this diagnostic process alone. Expert clinical intervention is the necessary next step to confirm your profile. During a comprehensive oral examination, an expert dental team will evaluate your bone density, your gum health, and the viability of any remaining teeth. And while this process requires an initial investment of time and finances, flexible payment plans exist to make accessing quality care completely stress-free. If you live in Queensland and are ready to take definitive action, book a consultation with the team at My Gentle Dentist in Arana Hills. You can initiate the process by visiting mygentledentistaranahills.com.au or by calling 07-3506-1234. Stepping into their transparent, patient-first clinic is the first real step toward confidently restoring your smile and your quality of life.